Hi everyone, I'm Dr. Megan Dowling, and thanks for tuning in to my Healthy Families Facebook Live video series, where I'm dedicated to bringing you important, research-based, unbiased information to help keep you and your family happy and healthy. So today I wanted to talk about something that I have personally experienced, and lately I have witnessed many of my postpartum patients experiencing this as well. This is something that I've come to call postpartum pain syndrome. And sadly, there is not a lot of research on this condition, and yet from my point of view especially, it is so common. It can show up anywhere from right after birth all the way through 1 year, even 18 months postpartum. And some of these symptoms they show up as general joint stiffness in the extremities, so the shoulders, the elbows, the hands, the hips, the knees, the ankles. Sometimes these symptoms show up on both sides of the body. They can show up as headaches, unexplainable headaches, sharp pains in the neck, upper back, and shoulders, as well as numbness and tingling, especially in the hands, and the arms. Sometimes even sciatica that's unexplainable. Which is, of course, numbness, tingling, pain down the back of the legs. One woman recently described her pain to me as being just an overall swollen feeling, which affects her most in the morning when she can't even make a fist because the joints of her hand are so swollen. Some of these women end up getting diagnosed with fibromyalgia or arthritis because their doctor has no explanation for their symptoms. And this is really unfortunate because this can mean getting put on medications that do absolutely nothing to address the actual cause of the problem, which we're going to talk about. And also these medications come with a host of side effects that really can make the overall problem a lot worse. So before we talk about what is going on with this condition, let me give you my personal experience with this syndrome. So when I was just 2 days postpartum with my daughter, I developed a horrible tendinitis in my right thumb. And I thought maybe I had done something in labor, like hit it on something, or maybe I was grabbing onto something too hard. You know how it is, you don't even know what happened in labor. But the problem was that it wasn't getting better. It kept getting worse. And this type of pain has a name. It's called nursing mom's hand, which they attribute to the repetitive stress of breastfeeding. And you're always holding your baby and moving your thumb around. So they call it nursing mom's hand. However, I got it when I was just 2 days postpartum, and I was attempting to breastfeed, but I wasn't doing it all the time, and we weren't even very effective yet, and I had just had a baby, so I didn't think that this could be caused by repetitive stress on my thumb 2 days postpartum. So I did what I knew to do for tendinitis. I had just graduated chiropractic college. I knew what to do with tendinitis, and that's what it is. It's tendinitis of the thumb tendon here. So I did every soft tissue therapy in the book. I did ultrasound. I did Graston, which is my preferred soft tissue technique for tendinitis. I did electrical stimulation. I did exercise. I even went to my colleague's office, and he did cold laser therapy on it. And honestly, nothing helped. And it was driving me crazy. I know this for what it is. It's nursing mom's hand, which is also de Quervain's tendinitis, and I've treated many people with it before, and for some reason this pain was not going away, no matter what I did. And I finally decided to immobilize my hand completely for 3 weeks using a brace. And for 24/7, for 3 weeks, I did not move my hand. And finally, the pain subsided. And this was right around 6 months postpartum. So the thing that really threw me for a loop was that this tendinitis was not responding to treatment at all, and there was a lack of cause of injury. There's nothing that I really did initially that caused the pain. It just kind of crept up. It just came on. So this really was not behaving like the typical tendonitis. So ultimately, these postpartum inflammatory joint issues are really difficult to treat because the underlying condition may be the fact that your body is just trying to heal from a traumatic birth. Birth itself is a very athletic, very stressful event, and it can take a while for the body to heal from the just trauma of birth. So there's also postpartum, there's hormones that are fluctuating and trying to get back to normal, and one of these hormones is called relaxin, and that hormone is going down. So relaxin is that hormone that helps us be really loose in our ligaments during pregnancy, which is good because we want to stretch out that pelvis as much as possible. But now those relaxin levels are going down, and that means those ligaments and joints are getting a little bit stiffer. So your body is having to get used to the new stiffness in the joints. And also those fluctuating hormone levels can really affect water retention. And when we're retaining too much water, they tend to hang out in the joints, and that's where we get that kind of swollen feeling. So when this is happening with my new moms, or even moms that may be 1 year, 18 months postpartum, I do a couple things. I definitely adjust them to help the alignment in the vertebrae and their joints, which helps take pressure off of those sensitive areas. Also, adjusting helps to decrease pressure on the nerves that might be affecting how an organ or a joint functions. And adjusting also helps drain lymph fluid more effectively, which can deal with a lot of the water retention symptoms. So I also recommend that moms go on an anti-inflammatory diet. And this helps in a very important way. If we can decrease the inflammatory baseline of the body, then it'll be harder for things that are irritated to get triggered and cause pain. And we have to know that the body, again, underwent a very stressful inflammatory event when we gave birth. So we really have to do our best to allow the body to recover by providing it with a lower inflammatory load. And the food we eat has a tremendous effect on our body's inflammatory baseline. And when we take out the most inflammatory foods, which happen to be wheat, dairy, sugar, and soy, the inflammatory status of the body is decreased enough to allow us to heal much more effectively. And along these same lines, I recommend taking a good quality fish oil, which has very strong anti-inflammatory effects, and therefore it can affect the inflammatory baseline of the body. And just when we take fish oil, we need to make sure that it's from a reputable company, like I use Nordic Naturals or Standard Process, because these companies use third parties to verify that their fish oil product has no mercury in it or any other toxins like PCOBs and other toxins, other heavy metals, which are rampant in a lot of the kind of box store brands of fish oil like Costco and CVS. So we do not want to take any fish oil that are from these kind of cheap companies, because these contaminants that are in the fish oil are absolutely the last thing you'd want to consume while you're nursing. So make sure it's a good quality fish oil. And also, if I see that somebody is really inflamed, I might recommend some additional anti-inflammatory support through herbs that are safe to take while breastfeeding. And some of my favorites are turmeric and ginger. They're really easy to get in through food, through the diet. And I also make sure that these mamas are drinking plenty of water, which kind of seems counterintuitive when we know that we might be retaining water. But it's important to ensure adequate hydration levels to help clear out that stagnant swelling that's happening in the joints. So the rule with water is to drink at least half of your body weight in water in ounces a day. So if I weighed 150 pounds, then I would drink 75 ounces of water a day. But if you are still thirsty after drinking 75 ounces of water, then you should drink more. So a good way to ensure that you are drinking enough water, at least meeting your minimum daily requirements, is to get a big water bottle. I have mine here. And know how many times you have to fill it up per day to meet your daily quota. So for me, this is 40 ounces. I need to fill mine up 1.5 times per day in order to meet my minimum daily requirement for water. So it makes it a really easy way to keep track of your water intake throughout the day. So lastly, I also recommend that that the mama is getting plenty of enjoyable exercise, exercise at least daily. And this may be as simple as just taking a walk around the block. You can also look into Pilates, yoga, or another gym class, all depending on your how far you are postpartum and your overall level of fitness. But movement is really important in helping lymph flow and decreasing overall inflammation. So to sum up my suggestions for postpartum pain syndrome, I suggest to, number one, get adjusted. That's going to help tremendously by itself. Also, number two, again, this helps tremendously, is eating an anti-inflammatory diet. And if you need more resources into looking how to get started with this, I suggest you just Google paleo diet. It's a great place to get started. Number three, I recommend to take fish oil from a good quality company like Standard Process or Nordic Naturals. And number four, if you need extra support, look into taking some anti-inflammatory herbs like ginger and turmeric. Number five, you want to get plenty of water, half of your body weight in water in ounces a day. And number six, get plenty of exercise, at least some form of daily exercise would be really helpful. So if you have any questions or comments about postpartum pain syndrome, please feel free to comment below, or you can private message me as well. And this is such a common postpartum experience that sadly does not get the attention it deserves. So help me spread the word by tagging someone you know in the comment section below, or sharing this video to your Facebook page. So have a great week, and I will see you next Wednesday. Take care.